Okay, our committee is all here. Great. I guess we'll get going. Starting here on the last day of March, 2021, March 31. It is 5:33. And the agenda is our first item. I think it actually says Thursday, March 31 on our agenda, the one I saw. So I just didn't want there to be confusion in the future if you look back and go, wait, was it March 31st or was it?
Sorry about that. That's my mistake. It is Wednesday,
Yep.
the 31st.
Yep.
I can
I've been
change that.
getting my days a little mixed up too, because of when the new month falls like on a Thursday. I've been having some challenges with that as well. So shouldn't be that hard, but it is.
I can make that change though. So for future, people don't look back and get confused.
Yeah,
So,
great.
thanks for pointing that out.
Sure. So any changes to this agenda from Counselor Hightower or Carpenter, either of you?
No.
You're good. Okay. All in favor of the agenda?
Aye.
Say aye. Okay, Christine, the ayes have it. I didn't ask for a motion. Sorry, that was, I guess, shortcutting. But minutes from February 25.
Move to approve.
Counselor Hightower moved. Counselor Carpenter seconded. Any discussion? Any changes? Nothing. All in favor, please say aye.
Aye.
Aye. Okay, we're moving right through it. We have now item 3, which is public forum. And I know Christy Delphia wanted to speak. She did tell me that in advance and asked if she needed to fill out a form or anything, but I said, no, just show up. And our Christine will let you in.
Okay, I'll move her over now.
Hi, everybody.
Hello, Christy.
How are you?
Doing well.
Good.
How are you?
I'm recovering. I had a shot yesterday that was not my COVID shot, but my second shingles shot, and I felt really lousy until just a little while ago.
Yeah, I've heard there's been
Oof.
a lot of people that have had bad reactions to those single shots, but I'll tell you what,
Shingles
better,
yeah.
better the reaction than the shingles.
I know that I know.
That's some serious shit right there. That stuff, oh my God. I've seen a couple of people, they are huge. They are painful, and there's no amount of medication you can take that takes the pain out.
No, you're
No, I've
telling
been-
the truth. Yeah, yeah. All right.
So I think this is an awesome idea. I think we do need to have an agency to help the elderly in the city of Burlington. And I would be perfectly willing to help you all write something up. The only one that we have that I know about in this area used to be called CVAA.
Yeah.
Champlain Valley Agency on the Aging. They have changed their name to Age Well. And if I'm not mistaken, their office is still in Essex, but they don't have the money to really provide very many services to the elderly, even in their own area. So when we in Burlington try to call them for assistance, they take reports, and that's basically all they can do, so there's a lot of things left out for the elderly, finding housing, all different kinds of stuff is what's needed in Burlington. So the only place that I could recommend that you call to get any kind of information on exactly what is provided for seniors in Burlington would be the Visiting Nurses Association. Because they do a lot with anyone that's elderly, that's homebound, but not in a nursing home or not quite nursing home ready just yet.
Mm-hmm.
And they need a little bit of assistance, like people, they may have had a medical procedure that they need assistance with coming out of the hospital, or, just a check-in a couple times a month. They do all different kinds of stuff. So that's for as far as the research part of it that you could contact.
Thank you.
You're welcome.
And Christy, did you want to speak to us about any housing issues? Because you and I talked about it earlier this week, and I just wanted to see if you wanted to mention that now or hold that off to another time.
Yeah, we're finding a lot of issues with tenants and code enforcement. Very big issues. They treat the tenants here like absolute garbage. They talk down to them like they're stupid. They do not charge the landlords the money they're supposed to be charging them for major issues with their housing. Half the time, they won't give the tenants the information they require. They won't give them copies of reports that they've written. They don't tell the truth in their reports. They say that there are no actual violations that will hurt the tenants. This is not a good thing. So we're thinking about changing the Housing Board of Review to be an oversight board, because we know Mayor Weinberger is the DPI office boss. He controls that department. There is no one over Bill Ward other than the mayor. And we already know exactly how he feels about housing in Burlington. He hasn't really paid much attention to it with all the screaming that we've been doing. So Housing Board of Review in many cities has been turned into, for lack of a better phrase, the oversight board that forces code enforcement to do the jobs they're supposed to be doing and follow the codes as they're written. Right now, Patty Wayman sat at this meeting last year without you, Ms. Carpenter, or you, Ms., or you, Zariah, and stated last year that landlords are allowed to pretty up their buildings to get their COCs. Does everybody know what a COC is?
I
Okay.
do, yeah. Yeah.
That doesn't mean the buildings are up to code. It just says they're allowed to get away with slapping lipstick and mascara on a pig and calling it good. It's very dangerous. It's leaving a lot of people in housing that's literally falling apart around them. This is for the money, especially now for the money they pay for rent, is unacceptable. We've got to figure out how to force Bill Ward to do his job and follow those ordinances as they're written, because they're there to protect everybody, homeowners and renters. And it's not being done. So Brian, Gene Bergman, and myself had a meeting Tuesday morning. We're doing a bunch of research right now to figure out exactly what that might look like to have an oversight board. We're going to have the appeals process with Gene Bergman's suggestions be separate from that, because we want the legal part of that to be covered all by itself. And we don't think that the board itself would be able to handle both. So the process for appeals needs to stay as it is. And we're only just going to change the board itself, the abilities of the board itself. So that was everything that I had, Brian, unless you've
Thank
got
you.
something else that you
No,
can
thanks,
add.
Christy. I just wanted to make sure, since we discussed it earlier, I wanted to give you a chance to share that, and appreciate your comments. We'll keep going through our public forum, and we'll be following up on those items.
Thank you.
Yeah. So Christine, is there anyone on this list of 16 attendees or participants beyond the panelists? 11 of them. Yeah. Anyone raising their hand looking to speak now, or do they? Because we will come to an item which I believe many of the folks are here to speak about, which is the, call it Council on Aging. That's not really the name of it, but that's just what we've been calling it.
Yep, I'm just checking my email. I don't have any other requests right now for public forum.
Okay. I did see Rebecca on here, who I think is going to give us an update on the early learning initiative. So we'll start with the youngins, and then we'll go to the less youngins. Hi, Rebecca.
Nice to see you.
You too.
Yeah, absolutely. You beat me to it. I was going to make some comment about starting at the other end of the age range. But here we are. So I'm thrilled to be here today. I don't know if you all saw it, but we put out an annual report about a month ago at this point. We sent it to council on the early learning initiatives. And so we thought it was important to come and just kind of give an update on where we are over the last couple of years and make sure everybody's familiar with where we're heading. Okay. So
through that.
Yeah, great. I'll start from the beginning. Again, Rebecca Reese with CEDO. I've been working with Brian Lowe on this project for the last few years, and I'll get started. So we started this project looking at the childcare landscape in Burlington. There wasn't enough of it. it was too expensive and was really difficult to access. So that's where we started the process. Oh, whoops, I need to share my screen. Hold on.
Yes,
Sorry about that.
it's okay.
Okay, there we are. You can see the full presentation, correct?
Yes,
So we wanted to address those 3 problems. So over the last 3 years, these are the big highlight takeaways of what we've been able to accomplish. The capacity grant program, this was our first step to actually build more spaces. We've created a 38% increase in high quality childcare spots for children ages 0 to 3 years old. So the youngest of the kids. I have more details and numbers on my next slide, we'll get there. And then the First Step Scholarship Program. It's the second process we went through, and we wanted to be able to create a program where then low income folks could access said childcare spots. So to date that we're in our second year, our first pilot year was the school year of 2019 to 2020. And then our second year started this year, and it started at the beginning of September 2020. So we've had a total of 57 scholarships, which is an 81% enrollment from the 70 applications we've gotten in the last 2 years. 23 children were placed in the first year, and we increased up to 34 kids this year, which we're really proud of. So here is just kind of a quick overview of the capacity grants we put out. Again, this was money to both actually build new spaces, convert space, and then also money to stabilize spots. So $681,000 has been spent so far over the last 3 years. We've created 92 new spots, stabilized 106 already existing ones to make sure that they're there for the future. And 4 of these grant funded projects have actually created 8 new full-time positions in the city, which I'm really proud of. And really there's even more room to grow there, especially as we get through the pandemic and more people, more children and adults can gather in spaces again. So the bolded ones, as you can see here, actually show what projects opened this year. So the YMCA, their new building opened in really early 2020 that we know before pandemic, but obviously this year impacted them. Sarah Holbrook moved into their new space, I think in the spring. Champlain Valley Head Start, they opened a brand new center on Riverside Avenue. And then Next Generation down at the bottom, they actually applied this summer and opened a brand new center in downtown Burlington on St. Paul Street in the church. Just this fall they opened. So we have 18 brand new infant and toddler spots there. They've been a great partner. We have 6 children even scholarship there this year and plan on even increasing that number next year. So then we get to the First Step Scholarship Program. We still have money in the capacity grant side of things. And so if new projects are coming along, if people need support in that way, we are here for them. A lot of our focus has been put into the First Step Scholarship Program, getting that up and running and off the ground. So just, I'm sure most of you know this, but I did want to just do like a quick, a brief intro to it again. So the scholarship program, down at the bottom, you can see, was designed to layer our local dollars on top of the state subsidy funding that is already available, the Child Care Financial Assistance Program, CCFAP. It's a great program. It often doesn't go quite far enough, both for making it truly affordable for families and for making it so that childcare centers can operate at a more stable financial situation. So our money layers on top of that just to bring more funding into the situation. Our eligibility requirements for the scholarship to be able to apply for that. You must be a Burlington resident, but we are funding scholarships outside of Burlington. So your child care center can be outside of Burlington, but you have to live in Burlington. You have to meet the income requirements. We started out at 65% AMI, as you can see, $59,500 for a family of 4. This year, we actually made an adjustment. I'll speak to that more, but we've increased out to 80% AMI too, which I am very proud of. I think that's really important to be able to actually encompass all of the low-income families in the city. the kiddos must be under 3 by September 1. Anybody that's 3 before September 1st of whatever year, this year in particular is 2021, is eligible to receive the Act 166 universal pre-K funding. And our money and that funding, like they don't mesh well together. So we have to keep it before they're eligible for the UPK money. And the kids must be enrolling in full-time care. So that's at least 26 hours a week. We have not gone into the realm of part-time care. One of our guiding principles is continuity of care and making sure the kids get enough of the exposure and education part of the side of it too. So that's why we're sticking with full-time care. Okay, adjustments. Like I mentioned, last year was our first year, our pilot year. So we learned a lot from it. So even pre-March 2020, we had made some adjustments to the program. Those included limiting family co-payments to 5% of their income. This was really important. Again, CCFAP is great. It doesn't go quite far enough and doesn't make it affordable. Even some of the co-payments that we had the previous year were difficult for folks. And so we settled on this limiting it to 5%, which made it easier for people to plan and really know that if they were required to have a co-payment, they knew it wouldn't be too much. The next part of it, again, following those guiding principles, always keeping families first and making sure that it is like a simple program to follow and administer, and partner programs like childcare centers are interested in working with us, is creating a scholarship tuition minimum. So we put a floor on it this year. And again, that just made things a lot to flow easier to understand, and it made it so that the centers could plan a lot easier as well. So then typically what happens is we open our application process in March. So last year, our application process opened 2 weeks before the shutdown. So things obviously paused for a minute. We had to kind of step back, really kind of figure out how we were going to be able to move forward and still be able to have this important community resource for folks. So what we did was these are the 4 listed out below it. So initially the program was designed to get new children into care. We lessened that requirement a little bit this year and allowed children that were already in high quality care to apply to the program. Their families could be experiencing new financial hardships. They could have maybe just missed the mark last year if they happened to be enrolled before the pilot year started, that kind of thing. And that's really made a big impact both for families and centers. Like I mentioned before, we had an application period with a deadline, and then we got everybody enrolled over the summer. We moved to rolling applications and enrollment, and that has made a huge difference. Necessity has really shown how much better we can make the program. And this is one of those things. So we'll be carrying this forward for sure. Not everybody has babies at the same time. Not everybody enrolls in early childcare just like they enroll in public school, right? A lot of enrollments take place in September, but they happen all throughout the year. So shifting to rolling applications and enrollments allowed families to apply when they needed us, when they felt comfortable in these uncertain times, and whenever there were the spots at the child care centers to access. So it's really helped us find new families, support them when they needed us, and even gain more spots and we would not have been able to access before. Like I mentioned before, we increased the qualifying household income to 80% AMI. So grabbing all of those low income families in the city now, which I find really important. The scholarships for the folks at the farther end of the income spectrum look a little different. They don't quite follow that 5% of family income for co-payments. So the folks that are over 65% AMI, so 66% AMI out to 80%, those families will get $125 weekly like tuition supplement, and it'll be layered on top of their CCFAP to work to bring down their childcare costs. And then another thing that we did just for these first 6 months of 2021 was to increase the scholarship to the maximum amount for everybody enrolled in the program. And it's really made a big difference. It's eliminated anybody's need for co-payments for this first 6 months, and it's also supported the child care centers as well. And all of these adjustments have really, we have from the pilot year to this year, we've actually been able to increase almost 50%. If you look at the families that have really stayed enrolled both years, 20 families the first year and 30 this year, it is actually 50%, which is exciting. So this just kind of breaks down some of our numbers. We've got a total of 70 applicants over the last 2 years. We've offered placement to 67, so that's 91% offering placement. Not everybody accepts it, so we've enrolled 57, which is an 81% enrollment rate. Right now, we've got 30 kids enrolled, so and then 20 the first year. So over the last 2 years, 7 families have left. For various reasons. This year, there were a couple COVID reasons, a couple health concerns, some families moved, a couple other families just stopped, they just didn't need childcare anymore. 40 of the families that have applied, of the 70, actually 40 of them live below the federal poverty line. 15 of them, or 21% of our applicants, speak a language other than English. And then of our enrolled families, so of this 57, of the 57 families, we've had 53 note that they need childcare to be able to either keep employment or gain employment or training. And that 34, again, of those enrolled families are single parent households. This just kind of gives a list of our partner programs right now. We've got 13 active partner programs. 11 of them have enrollments. Down here at the bottom, the 4 that are bolded are our new programs that we pulled on this year. Heartworks Preschool actually technically came on, one of our students moved over there in July, but I still included them as a new program. And so again, 13 partner programs, and here we can kind of see the distribution of where our kiddos are enrolled and kind of what towns they're in. Here is a breakdown of the costs. The pilot year, we spent about $92,000 for an average family cost of just over $4,000. This year, we've got 50% more kids. We've got 30 kids that were scholarshiping now, a high of 34 at one point this year. So it is more expensive, $168,000 with a family average of $51,000 or $5,100, sorry, excuse me. And that does include that tuition increase from January to June. And then the CCFAP total. So not only are we bringing in local money into the childcare system, but we're also pulling in more of that state funding as well. And you can see those totals down at the bottom, 222,000 the first year and 293,000 this year. We were actually, the state was at more than a 2-to-1 ratio of our money, but whenever we increased our scholarships for the first 6 months, we dropped just below it. These are just some tidbits. We've recently done a childcare partner program survey and been talking to families as well, just as we kind of, which is crazy to think, but start to wind down the typical school year and go head into summer and get ready for the next year. 4 of our partner programs have been able to increase their teacher compensation, in part due because of the additional ELI funds. 6 partner programs have stated that they have the ability to, their bottom line now allows them to, and they have been accepting more CCFAP students, which was definitely a goal of the program. And one of our partner programs let us know that they were able to even keep their tuition rates the same this year, which is the first time in several years. Family and direct impacts of our families, beyond having childcare and all this, these are just a couple of specifics. One family had an older sibling enrolled that they were able to bring onto the scholarship program, and it allowed them to keep their whole family in care, which again follows that continuity of care, and then allowed them to be able to be ready to go back to work. They had childcare already. And then another family had their hours cut in half, and because of our program, they were able to keep their jobs. If they hadn't had the support of this program, they would not have been able to afford care, and so would have had to quit to stay home with their kids. So now we're looking ahead and starting our planning. Again, I mentioned we typically started our application process around this time we're continuing with the rolling enrollment. So we're pivoting a little bit with that. We've already had like up to 20 new spots committed for next year, which is really exciting. So with the kiddos that we have enrolled now, we've had 30 enrolled now. 12 of them will age out up into that preschool age. But with those spots we have now and the new ones committed, we're looking up upwards of potentially 45 spots already reserved for us for next year. So that's a really solid footing to get going on. Our marketing is beginning next month, well, you know, in April and May, to bring families in, get them enrolled. Potentially some June spots are opening up. Sometimes centers have those open at the beginning of the summer, but then the most of the enrollments will still probably happen around the beginning of September. We are working with BSD and Head Start to get a real robust outreach partnership going. We've talked with BSD a little bit last year and had some communication with them this year, but there was just so much going on. It wasn't feasible to add more to their plate. That they are going to be such a big partner on really finding those families that need us. They have such a wide net. They know the people that are out there that need us. So we're excited about that. I think it's going to be really big. Recently, a new American childcare survey came out, childcare needs survey came out. And so we are actually already in meetings starting next week with Building Bright Futures to really dive into that data and address some of those needs and how our program is going to work with that and make that better. And then also the economic recovery, as we start to come out of this time, the economic recovery is going to be a big hill, but childcare is going to be absolutely imperative, a vital resource throughout it. So I think the city of Burlington, with what we have here with ELI already, is ahead of the game, and we can just continue to build on what we've done and really offer even more resources to our community. And that's.
Thank you, Rebecca. Any committee member questions for Rebecca on the early learning initiative and the information she just presented?
This is just for my own education. The city, what's the source of the city money? Is it our general money or is it CD?
No, it's the pilot funds, the profits from the utilities from BED.
Okay, yeah.
It's essentially payment in lieu of taxes that
Yep.
the state said you can't use for your schools anymore. And so we
Yep.
had to repurpose it.
Yep, okay.
Yeah.
Just younger education. That's why we can't cross that preschool mark.
Yep.
Yeah. I'm wondering if, I know in other parts of the state, there's been actually a reduction in the number of slots. Have we seen any decreases as well as like to kind of set us back with some of these increases in our region? Do you know?
So, I mean, I'm sure you've heard about the big closures, right? UVM closed their center. But at St. Mike's, but honestly, St. Mike's, like the parents really rallied there and should have been able to reopen that one. So far, we have not seen it impact. I'm not saying that it couldn't possibly happen again, but we were able to bring Next Generation online. Sarah Holbrook is actually already planning on bringing a few more like non-Head Start spots online. So we would be able to partner with them on that. I've looked into this. I've checked with Child Care Resource, the organization that administers the CCFAP program here in Chittenden County. And when UVM closed, only 2 families reached out to them looking for care, and neither of them lived in Burlington. So I'm not saying that it won't impact it as things open more, but we're working with folks and trying to make sure that we can mitigate that as much as we can.
Anybody, any questions from other committee members?
No.
We've had some
Yes.
suggestions in the chat, Rebecca, about how to kind of spread the word a little bit more. So I think you can always take outreach ideas. So
Please, absolutely.
Christy Delphi is on the meeting and she has some ideas to share with you for sure. So I
Yeah.
would urge you to take her up on that offer. She's somebody who can maybe bring new ideas to how to outreach. Yeah.
Great.
So
Thank you.
it's
I
one of those
appreciate that.
issues. Childcare is the issue for me that you only really deal with it for a period of time usually, and then you move on because if you have children, your family moves on. So there's just a need for continual, involvement of folks who might stick with it. And I'm really happy that you've stuck with it and that we have this program, because I think this was a a real need. And I can say when our kids were little, it was remarkable how much scrambling we had to do to find decent childcare. But we also had the advantages, and we had one advantage was the Burlington Children's Space was still affiliated with the city. And since I work for the city, we got kind of a little bit of a foot in the door to get, as city employees, we had first
Yeah.
access to those slots. So
Yeah, I have a 3.5-year-old, so I hear you. I totally understand. We've been doing the dance for 3.5 years now. We've since landed and we had really wonderful care. I don't want to make it sound like anything else, but it is difficult. It's always tough. And we've landed in a really amazing preschool right now, and we're incredibly so thankful for them. But because of everything, the hours have been reduced. So, it is still, there are still aspects there.
Yeah.
all right, it's all right. Go ahead.
Yeah, one question kind of based on Christy's question. Do you have any idea, because it sounds like you are able to move on most people who apply. So I guess, do you have an understanding of how many folks or households you reach compared to what the need is in Burlington?
Yeah, so these are estimates, right? So using how many kids are in each grade, kind of like a median number of the kids in the grades in the Burlington School District. And then a general number, this comes from Let's Grow Kids. It's just kind of like a rule of thumb number that maybe 70% of families are looking for care. 30% of them don't need care. They're home with their kids, they have family members, whatever. So 70% are looking for care. Right now, we're working off the number of 230 families, or 230 kids in each grade. And so about 230 families, 70%, calculator here, right? I don't have the rest of these numbers right in front of me. So let me do that real quick. Oop. So it's about 161. So it's 161 families each year kind of thing. So we've had 70 applicants, so it's not quite there, but we're pleased that we were able to continue to grow the program this year and have really high hopes of working with the school district on getting that outreach farther. And just like Christy brought up, like social media posts and all that, and we've put it out there. It's been on Front Porch Forum several times. Our childcare partners, like the centers themselves, have been huge. After the first year, they bought in. They saw the advantages to what this has brought. And so they've sent us a lot of families too. And yeah, but that outreach piece is definitely where we are still working to figure out what the best way to find everybody.
Great. Well, this was great. I had no idea. So thank you for the presentation.
That's awesome. Yeah, wonderful. So we did, and then, but again, about a month ago at the end of February, the annual report came out. I can send a link around if you all want to take a look at that. These are the highlights for sure. That's what I reported on, was the report.
But I think Councilor Hightower's comment reminds me that unless you're on this committee and we hear your presentation, the rest of the 9 members of the council have very little visibility. So I think maybe, and we get a lot of stuff. I don't know if you know that, but we get a lot of stuff to look at. So sometimes it really helps when a person comes and talks to us about what they're doing, like you just did. So
you didn't read every word of my report? What?
Well, I skimmed it, but yeah, this was good. This is really helpful.
Yeah, that's great. Thanks for having me. I was happy to come.
Anything else, Sarah, Zariah? Anything else before we?
Thank you.
Thanks, Rebecca.
Yeah.
Thank you so much. And
Thanks.
we may be asking you to come and do a presentation for the council, so councilors are aware, especially as the budget season goes, because there's going to be a budget request for this item. So
there will be. Absolutely. So yeah, and also I'll send the link to the report around.
Great.
Thank you.
Thanks. Have a good evening, everybody.
Yeah, you too.
Thank you.
Thanks.
Okay, Christine Curtis, we are now going to talk about the Council on Aging, or the whatever we're going to call it, if we call it anything. But did anyone indicate, we have a long list of stakeholders here, and I don't see Cameron, but maybe Cameron handed the torch to someone else.
East Living Well Group is
Oh, he's on there. Yes,
Yeah,
he's Living Well. Thank you.
I was going to ask you who I should move over. So I see Kelly, AARP.
Kelly. Megan, I think.
Megan, Living Well Group.
Angela.
Yep.
Dale.
Yep.
Angela, okay.
And
if I'm forgetting anyone, you can please raise your hand or use the chat.
Molly Dugan is with Cathedral Square and asked to be included. So let's bring
Molly,
Molly
okay.
Dugan in. Yeah.
I can tell you, I every time sign out of my work Zoom and sign
to
into my
change your
personal
name.
one.
Yeah.
But I can't. You can't when you're not a panelist. So
Yes, that's right.
it was me.
Exactly.
Here.
All right.
And
Now,
I
if
have,
there's anyone else over there that we just didn't recognize, please. Oh, I see hands raised.
yep, I'm moving them over as well.
Okay. Yep.
Okay,
Great. These are our senior stakeholders here, at least some of them. I'm really thrilled to have you all here. And we're excited to have this conversation because we're all going to be there someday, we hope.
Some of us are.
Yeah. Well, Sarah, kind of. Yeah. All right. So who wants to take it from here?
So we have, I'll run through a presentation that we put together real quick.
Great.
And then we have everybody here who can talk. So I'll share my screen if that's cool. So real quick, I want to thank the committee for the opportunity to do this. This is the past few months going through this, we've all really appreciated how exciting an opportunity this is. So this is exciting. So we put together a presentation. These issues can be really detailed, but we wanted it to be simple and comprehensive. So yeah, let's do it. So it shouldn't take too long. So I'll share. Tell me you're seeing this presentation.
We are seeing it perfectly. Yep. Thank you.
Great. So this is a presentation for framework development for Burlington Aging Council. And to Christy's point, I think, or what she brought up, the Council on Aging, Age Well. I think the Council on Aging is confusing and it's something we tossed around. So I think the Burlington Aging Council seems to make the most sense because we'll talk about it in a bit, but it really shouldn't act like a regular committee. So it isn't a committee. So the Burlington Aging Council, the group of us who worked on this, Angela Smith-Jang at Dale, Kelly Stoddard-Poor at AARP, Megan Humphrey at Hands, Heather Filano from UVM Health Network, Home Health and Hospice, Molly Dugan from Cathedral Square, Jim Hallway, and then myself, Cameron Siegel from Living Well Group. So a bit of background for folks who don't know who are on the call. In 2019, City Council created the Senior Center Study Committee to review a number of things, but as far as I know, primarily the future of the Heineberg Senior Center. And along with support for the Heineberg Senior Center, the committee did recommend the formation of a council on aging. And then from our perspective, after a year of the concept really not going anywhere, COVID, I think, moved it to the forefront, seeing it impacted this population. So ended up at CDNR. And then a few months ago, CDNR tasked this, the creation of an informal group to put together a framework proposal. And it's just what we have. So a bit on the purpose and creation piece, we wanted to be really clear, like I said, and so I'm just going to read these four main goals. These are what we've established. So one is to elevate the contributions of older adults in Burlington. Two is to raise issues facing older adults in Burlington and the organizations that serve them. Three, to make policy recommendations to the mayor and city council to address gaps, needs, and opportunities that impact older adults in Burlington. And four, to ensure that the voices of older adults in Burlington are at the forefront of city policy. And like I touched on, unlike other boards and committees, like this is different. So, you know, we agree with the proposal that Councilwoman Nodell put forth, that it should be a city council resolution that creates this group, not city charter. So first, I want to go through the driving philosophy, the credo of the Aging Council is just this, that older residents of Burlington must be valued members of the community. We on this call know that older adults are overlooked nationwide, and it's just the way it is. But these are homeowners, renters, business owners, employees, volunteers, like civic leaders, artists. They're in our community. And what's fascinating about this group of people is that you can have somebody who's 65, you can have somebody who's 95. So the needs and the contributions change as with that 30-year age gap. And so we did want to touch before we moved on that We want to address ageism, that it's a massive embedded problem in our society. It's not one that a single policy is going to change, but we do believe that the policies and the work that this council can help provide at the city level can help fight ageism in our town and our city. And so it's an education piece and it's an inclusion piece. So ageism is a tough nut to crack, I'll say that, but it is, you just have to take steps, and addressing aging in Burlington from the level that we're presenting should just inevitably combat that a little bit. So what we wanted to do is we wanted to lay out clear focus areas for this council, because when you just talk about it in the conversations we've had before the creation of this group, it could go anywhere, right? So we came up with 10 or so focus areas that are encompassing, but also pretty abstract in nature at the same time. So I want to just first say the multifaceted intersectional nature of this means that this council will have to act a little differently, like I've said a couple times, than other committees or commissions, but can propose the issues to the mayor, propose issues to city council, and then propose issues to standing boards and commissions, because a lot of these issues fall within the scope of work of existing commissions. And so that's a really interesting piece here, is that it's not going to act like the airport commission or the cemetery commission. There's not one task that it can do, but it can provide recommendations to committees like that. So we're going to go through the focus areas, but I'll just lay them out. So it's health, food security, transportation, accessibility in outdoor and indoor spaces, housing, social inclusion, technology, civic engagement, industry support, and family caregiver support. Now, this is a starting point, but this is us trying to nail it down as well as we could. And I want to say, before continuing, that note at the bottom about diversity, equity, and inclusion, it's not on the focus area list, but because it kind of can't be, because it's involved in every single one of these focus areas and should be a driving force in every single discussion. So it not being on the list is not an omission. It's actually, it should just be a staple in the work that this council does. So we wanted to make a point and say that here, that if you just scanned it, it's not on there, and there's a reason. It's because it can't be. If it was, all of these other things would be within it. So the first to talk about is health prevention, access, and quality, focusing on nutrition and physical activity. So that one's obvious, right? I mean, I think you don't need to be an expert in aging biology to know the impact of health on older adults, but it's a couple things. It's older adults in Burlington need to have the access to affordable healthcare, and then that healthcare needs to focus not only on treating issues that arise, but preventing it. And that's smart. It's good morally, it's the right thing to do, but it's also smart for our healthcare economy. It's healthier older adults, it's less taxing on the healthcare system, less taxing on housing organizations. So the health access is, the health access and quality piece is pretty obvious, but physical health, dental health, foot care, eye care, mental health, substance use, misuse, and then simply access to primary care physicians and geriatricians. Those things, we're going to touch on a couple other pieces that impact that. They're often just ignored in this population, and it's a shame. So those are the core. It made sense to have health number one, but it's not necessarily more important than any of the ones to follow. So the next one is food security. So 10% of older adults in Vermont are insecure. That's a shocking number. We don't have 10 residents, so it's not like there's, it's thousands of people, and that's a shame. And we have great organizations that we're going to touch on just a bit later with the membership makeup piece that are working to fight this and help these folks. But food security needs to be at the forefront of this discussion and one of the driving focus areas. So, there's so much value to programs that already exist, like congregate meals at senior centers, but it's never enough. Of course it's not enough, but it's never, ever enough. And there's always more to be done, and more advocating, and just keeping this at the forefront of initiatives. So I know we have Megan on the call who could probably talk for hours on food and security. So the next is transportation, and we have multimodal transportation. So this one's sad. All of them are sad, but it's sad the access of transportation, the real impact it has on the lives of older adults. So they miss church, temple, book club, bingo, but they also miss doctor's appointments, and they also miss trips to the grocery store, right? So it's pretty much mentally, or physically, emotionally, and spiritually, the lack of transportation causes you to sort of miss out on those pieces, and that's hugely detrimental. It goes without saying that reliable access needs to be at the forefront of the work that this council will do. And so that's from safe and clear signage and shelter at public, at bus stops, and handicap accessible options for folks, so it's inclusive to all ability levels. And then the transit to and from, whether it's a gathering point or from their homes, that access, like taking folks from their house to the grocery store, or from their house to a senior center, to get them, to include them, to connect them. That piece of transportation is really important as well. So the next is the accessible indoor and outdoor spaces. It's fitting, it's right after transportation, because that second sentence in the first bullet to me is really tough. So it says, currently about a quarter of older adults in Burlington report that if they could no longer drive, getting around their neighborhood would be difficult. So they have a tough time getting access to transportation. And then 1 in 4, when they say, okay, I want to leave my house and try to walk somewhere, report that they would have real difficulty doing that. And that's a problem. And so it's an opportunity to provide for the older adults. And so that's taking a look at the seasonal impact on public spaces, making sure that sidewalks and roads are accessible for wheelchairs and walkers, right? Like big cracks in the sidewalk and potholes are not conducive to safe wheelchair or walking. Extended intervals at walk signals, right, for slower moving pedestrians, things like that. And this is a really a good example of one of the focus areas that could work and should work with an existing department and committee, right, like the public works piece. Like these recommendations to a committee like that, or to a department, making sure that some of the initiatives and things that are being done are inclusive to all ability levels. And yeah, so that one's a little obvious too, the outdoor spaces. Housing is a big one, as we all know. I think if you polled Vermonters as a whole, they would say housing is probably one of top 3 issues that they face, and older adults face it as well. And so in the state of Vermont, 26,000 Vermont renters who are 65 and older were paying an unaffordable amount of their income towards renting, or their property taxes, what have you. And then on top of that, about 15% of Vermont's homeless population are 55 and older. And we all know that the homeless population faces challenges themselves, but older adults that are homeless face are especially vulnerable to the challenges that the homeless face. And we also know that a good portion of Vermont's homeless population are in Burlington. So this is a major growth opportunity for Burlington to care for older adults living in Burlington. And the second bullet, so the high cost of living, I think, again, you could poll Vermonters and they would say that that's a problem also. But we know that Americans and Vermonters, when they're polled, report that they want to stay at home as long as possible, right? And that makes sense. I think we all probably on this call feel that way. Nobody's really looking to move into a nursing home if they can avoid it. And so, if the high cost of living, the affordability is a major factor that impacts on older adults' ability to actually do that. So it's massively important. And we have Molly on the call, but even if she wasn't, I would want to take a moment to say Burlington has fantastic housing organizations, and COTS, a homeless organization, but there's still more to be done in terms of building capital and addressing gaps in those options, rental assistance so that it actually is truly affordable. And then once they're in the homes, that programs like SASH are able to actually care for them. So it's make it affordable, give them access to it, right? Make it available, have enough that there's empty units for people to move into. And then when they're in there, that they're able to live and they receive the services they need. So housing is a big one. And it's one that I think is felt regardless of how old you are, but especially if you're 65 or 55 and up. So the next piece, social isolation. It's social inclusion, but social isolation is being tossed around these days. And I know people are starting to understand what it is, but I'm not sure if everybody understands the health impact of social isolation. So there's a few studies that have linked the effects of loneliness and social isolation to risks associated with smoking and obesity, and that's really bad. That's tough. So it's like if we have these folks at home who are disconnected, it's not in a vacuum. This has impact on the health. This has impact on their health care. This has impact on their food access. And we see the flip side of that. When we connect these folks, we see drastic improvement in their, this 50% reduced risk of early death. And so the social isolation piece is massive, and it's one of those focus areas that is just sort of connected with all of the other ones in a way. And so, Burlington just needs to continue doing a good job that it's already doing in engaging and supporting initiatives that connect older adults to programs and opportunities for them. The next piece, COVID has shined a light on technology. The entire world basically decided we were going to work from home and have doctor visits at home, but by doing so, we kind of just excluded a sect of our population who might not have access to reliable internet or laptops, or even be educated to use those if they did have that. So I know I had my first telehealth appointment a few months ago, and I was stuck in the waiting room for 45 minutes, and I just know I can wait there. But if I somehow got there and was somebody who wasn't comfortable with it, I probably would have just logged off or something. So the many older adults in Burlington still don't have access to reliable internet. We know that many of them don't have access to a laptop or a tablet or a smartphone that's necessary. And then, like I said, if they do, many of them actually aren't comfortable using it to the extent that's necessary. And it's no longer going to be okay to say, it's really nifty, he's really good at email. It's going to have to be, you need to be competent on some level technology wise, and if it is in 2021, it's going to be even more in 2030. So this technology accessibility piece is really, really important. So the next one, we're going to talk a little bit later about membership makeup and creating a space for older adults living in Burlington. But this is where the civic engagement piece in my mind comes out, is engaging them actively in city policy, right? In state policy and initiatives and in volunteering. So, this meeting is a perfect example. I can't see who's in the meeting, and I know Christy is, but I wonder, this is a big deal for older adults, and how many of them even knew this was happening. And so if we want to keep we want this council to be sustainable, and in terms of the voices of older adults who are living in the community, we need to foster that civic engagement piece, and it's valuable, it's rewarding. I mean, you guys know that, right? And so, this one touches on the social isolation, which touches on the health piece. So they all really are interconnected, which is good, because you think if you work on one, you see impacts in some of the others. So this is the civic engagement piece. For the Community of Vermont Elders, an organization in Montpelier, has a really cool Grow Bold model strategy that engages older adults with state legislature. So it's an interesting model that Burlington could take a look at to sort of take some of the pieces of that and engage Burlington older adults. So the next piece, I can admit I'm biased. I represent an organization serving older adults, but the industry, the organizations that care for older adults are a vital part of the Burlington economy, from employing hundreds of Vermonters, statewide, but even in Burlington, and then also caring for hundreds of Vermonters. It is massively important that we support these organizations. And if we're going to take a look at policies and initiatives for older adults living in Burlington, you have to consider the industry as well. And we know, like I said before, that people report they want to stay in their homes as long as possible. So then if they have to move from their homes, they also want to stay in their neighborhood, right? And we need to support the organizations that exist there. So if you're in the New North End and you stay at home as long as possible, you want to make sure that there's still an option for you in the New North End once you end up having to leave. So it's supporting the organizations, is supporting the older adults as well. And so that's from workforce development to sponsor certification classes like LNAs, LPNs, things like that. And then access to funds for nonprofits like the Burlington Housing Trust Fund, which is massively helpful for nonprofits. And it's, our organization has benefited from that. And I know some others on this call have too. It's things like that. The industry can't be forgotten when we're focusing on the older adults, because they are older adults, right? So the last one, definitely not the least, is family caregivers, informal caregivers. They are the most forgotten, probably, when we talk about older adults, but nationwide, 30 million family caregivers, they're unpaid caregivers, caring for somebody in their family. Half of those are caring for somebody with dementia. in Vermont, you've got 30,000 people caring for somebody with dementia. So if that stands, you can assume 60 or so thousand Vermonters caring for a family member, and half having dementia. It's an incredibly taxing thing to do. Either you're doing it after work, either you're not working, you're fitting it in somehow. It's exhausting, and it's all day. And it doesn't get any easier when it's your mother. And it doesn't get any easier when it's your grandmother or your father, or your sister. It just doesn't. And this is primarily a gendered issue. 65% of the people being cared for are women, and like 75% of the people caring for them are women. So this is an issue that disproportionately impacts women. And so that's why it's really important. And it's initiatives, again, it's supporting initiatives, programs, and organizations that already, that care and providing service. But, this one was the last on the list, the list that we provided. It's definitely not the least at all. So that's the focus areas. The next piece that we left the CDNR meeting, the three of us that were there, feeling like there were three key points we needed to touch on. One was the focus areas, clearly define on some level what this council would focus on. Two would be the membership makeup. Three would be the city support, and four would actually be deliverables. So the next piece is membership makeup. So we wanted to keep the size manageable. Everybody's been a part of some group that has like 25 people, and you're not really successful. But as we know with these, how intersectional this issue is, it's challenging to make sure that everybody's included. So this is our list, and we feel comfortable with this list, and obviously it can be adjusted, but I'll run through it real quick. So one member representing a healthcare provider, that can be the UVM Health Network, Community Health Centers of Burlington. It could be a primary care physician. It could be a director of nursing somewhere, a long-term care organization, a housing organization, an organization fighting food insecurity, an organization providing advocacy and support for older adults, so something like Age Well or Cove, organization supporting new Americans in Vermont, a senior center in Burlington, an organization providing mental health services, organization providing transportation services, and then that standing member of CEDA that we'll talk about in a second. And then in addition to that, 3 to 5 spots just that are always there for older adults living in Burlington so that they can share their experiences. And you have the experts from the organizations in the field, but then you have 5 folks who are just living in it, and they can give their experience, and as diverse as possible would be the goal. But we wanted to make sure that there was, in our presentation, in our proposal, that there was a space for older adults who are just living in Burlington. They don't have to be working for an organization that is providing services to them. So the next piece is the City of Burlington support. And it was, I would guess it was the most important piece that we needed to present to the committee, but there really is no way around in our mind that it just does need staffing. And CEDO makes the most sense as the department to do so. CEDO has the scope in terms of the things that the department does, and CEDO's already supporting the Senior Providers Working Task Force, so it makes sense as a pivot from that to just continuing to staff this group. And the second piece of that is a clear and consistent avenue for communication from this council to the mayor and to city council and to other committees, because that's the only way that this thing will continue to be sustainable. We've seen a lot of councils sort of fade away, and this is an opportunity to not just repeat that again and really connect it to the way that the city functions. The next piece is deliverables. We only have 2 slides left. There was no way, unfortunately, that the group of us in 2 months would be able to put forth real deliverables for each of those focus areas. So what makes sense? What makes sense is what some other cities are doing, and what the state does on a level is a Burlington Plan on Aging, right? So Vermont puts out a state plan on aging that's based off the Older Vermonters Act, based off the Older Americans Act, but it lays out the priorities from the state's point of view to meet the needs of older Vermonters. So this group recommends that this council, along with, once the state puts out their plan on aging, the council puts forth Burlington's plan on aging. So it could be 1 year off, but the state does it every 4 years. But it would be a more specific to Burlington plan to outline services, priorities, and initiatives. So it would be a Burlington specific plan to sort of be a guiding template for city policy and initiatives. And it's a really nice deliverable that can then be spread out and managed from other sort of from that document. And that's how departments on the state level function from the Plan on Aging. And so it makes sense for us to replicate that here in Burlington. And then it's sort of it's a sustainable thing that's happening every 4 or 5 years. And that's really important. So the last piece is the potential for this statewide. That's really important for us, is knowing that the work that we do in Burlington benefits a tiny town in the kingdom, right? It benefits really small towns in Addison County, so that we can put forth our Plan on Aging, and it can serve in a way as a model for some of these other towns. So how's a small town in the Northeast Kingdom supposed to manage a problem, or not a problem, supposed to manage something as far-reaching and large as issues facing older adults when they're far less resourced. So this is an opportunity, I believe, and this group agrees, that we can present something to the rest of the state, and it's an exciting opportunity there. So that's what we have. I know this is your meeting, obviously, but it'd be great to hear from anybody else who wanted to share. I'm going to stop sharing, but that's what we have. Oh, and actually, that's not entirely true. We have we have an entire another presentation for 2 hours. So we have a letter of support from Dale supporting this council, and I'll share that with you all this evening. And I promise you that there are tons more letters of support coming, because our community is massively supporting this effort. So you'll probably be inundated with letters of support, but I will share Dale's today.
Thank you, Cameron.
Officially done.
You answered
Impressive.
my first question, was to put Angela on the spot and say, what does Dale think of this? So you kind of covered that. Does anybody else from this group? It's wonderful to have you here. There's a lot of good thought leaders in this room, so to speak. So I'd love to hear your thoughts and hopes and aspirations for this. Anyone? I think.
Well, can I
Angela's
just
first.
say how impressed I am that in a month you all did this hard work and put it together. So it makes our job easier.
It does really. Yeah. Good points. Thanks, Sarah. Angela, I think you unmuted first, so I'm going to let you.
Okay. I was just, thank you so much for having us here today. Thank you, Cameron, for doing a great job with the presentation. I would just say from Dale's perspective, it's really exciting to see this in the works, because there's a lot we can do at the state level, but to really address the contributions and the needs and supports for older Vermonters, it really requires all hands on deck from the federal, state, and local level. There's a lot that can be done in an individual community that's really important that we can't do at the state level. And so I'm excited, and I think the timing is really great, because we did pass the Older Vermonters Act last session, which really provides a good blueprint at the state level. And so the opportunity to then be able to align at the local level and support the work back and forth both ways, I think is a really great opportunity. I think Burlington is really poised to do some good work, and like Cameron said, be a model for other communities in Vermont to be age friendly.
Thank you. And Megan, were you ready to add something?
Sure. I just wanted to thank everyone on the committee also, because I think everyone did, as you said, Sarah, just really worked hard and quickly to pull it together. And I appreciate that. It was a great group to work with. And certainly that group should be expanded to include other folks as well, definitely, as this moves forward. And Cameron, thank you for your presentation too. That was well done. And I just wanted to say that sorry, that's Terry emptying the dishwasher.
It's a good thing to do.
Yes, sorry.
Better than you.
I did it. I did mine before the meeting, by the way. So yeah.
Thank you. Anyways, when Cameron was talking about, especially the social inclusion part, I worked at Cathedral Square when it first opened at 3 Cathedral Square, and I was a social worker there. And they were expecting a 10% attrition rate the first year, and there were 100 people there. Nobody died the first year that they were there. People were so happy. This was an especially, I think, a really unsafe group of people. I don't want to seem that extreme, but they were in some really difficult living situations, and they were so relieved and so happy to be in this housing where they felt really safe and secure. And it was brand new apartments. It was beautiful. Some folks had great views of the lake, and there was a social work program and, you know, people that were really helping them out every step of the way. But that was sort of shocking to me at the end of that first year, because we were just expecting a really different outcome. So it just shows how important that is.
And could someone just confirm for me that all those congregate meals that people used to enjoy, those are done, right? We haven't had any of those during COVID, right?
Correct.
That's correct. At least
because those are a huge community building, sort of isolation fighting, even if it's just for an hour. That's amazing. I used to participate back in the day in the 90s when it was down on Main Street, when the senior center was down there, and it was Cindy Zook running it. I used to come down and join them. And it was incredible to be there and watch the people have fun at lunch together.
And that's a huge concern coming out of this. I think we are going to look back and see numbers in long-term nursing and even senior housing. I think it's going to be really, really sad, the numbers of people who have passed away because of loneliness in the middle of all this. I mean, even, you know, at many of the long-term nursing centers, people and lots of other places, they're just eating their meals in their room by themselves every single day. It's heartbreaking.
So to that point, though, some good news. We just issued guidance that senior centers and adult day centers will be able to reopen beginning in April. So I'm excited that some of those group activities will be coming back.
Thanks, Angela. That's a bright spot there. Molly, did you want to add anything? Because you all provide a lot of housing and a lot of services. So it'd be great to hear from you.
Yeah, no, I'd love to. And I just wanted to thank this group, especially Cameron, who really, herded us all together. And it was such a pleasure really working with this group, and how, as Sarah mentioned, like it really did come together. I'm not going to say painlessly, but almost. And I think it's because of the partnerships that have been building, really over the last decade, where we've all realized we're all in this together and we have to come up with a common vision and we have to get to work. And I think that has been building over the years. And I think one of the things I'm most excited about this initiative in Burlington is, as someone who has focused over the last decade on, really building SASH, support and services at home, as a statewide model, that's been amazing, and all the different partnerships. What I think is so key is getting close enough to home for our older adults to really feel connected and informed enough to truly be part of this work and to truly advocate for themselves. And that's one of the things I love about the recommendation we made around the makeup of the committee, that 3 to 5, like that is where having older adults really own this is what's going to make this successful. And I think when we can bring it down to this local level, and as Angela said, we've done such great work on the state level, but that can feel really far away to some people. So by Burlington being willing to really get this hands-on approach and embed this in the local community, I'm just really excited about older adults really having the opportunity to really be informed, be able to participate, and really own it themselves.
Thank you. I think I would just add that the council is heading into budget season, and that if there is a budget request for support, staff support for this, we ought to get something together. And I don't know if it was discussed as to what level of effort is required when you talked about CEDO staff supporting it, because I don't think there's anybody at CEDO looking for more work to do right now. Marcella, is that true?
Whilst not looking for more work to do right now, I'm currently supporting staffing the senior providers working group that's meeting, you know, as part of COVID response. And you know, it looks, if we can look at the timing of this to coincide with hopefully the work on that drawing down, there should be some capacity to provide some supports. But yes, it needs funding.
Okay. Thank you. I think it's fair to say that this will be an issue that I think will be an easy one to get the council on board with. It's just a matter of doing the, you know, the logistics of the finding the money for it, you know, finding the structure. Sort of the startup is, it's an undertaking, of course, to do a startup of anything, but I'd be interested in hearing from Councilors Hightower and Carpenter what your thoughts are.
Well, I'm impressed with all the work the working group did. So they really have made it easy. And I think from the committee's point of view, we need to wrap that into a resolution and get it out there as quickly as we can. And before the council. It is sort of we're in an awkward place because of the CEDO staffing and the lack of a director, but maybe the committee can request, or one of us can have a conversation with them in terms of sort of all of these logistics and how they see that fitting into their planning and their workload. I mean, it just seems clear we need to move ahead on it, and I don't see any huge stumbling block other than hopefully the level of participation and energy will continue, and it sounds like it is. So.
Yeah, and I'll add, I have no feedback content-wise. Thank you all for putting all that work into it. But I feel like in this role, I'm really more of one to listen than to offer other opinions. My only, I guess, question or thought is around one of the slides you had was on like continued engagement and what that should look like. And you had listed, I think, the mayor, city councils and council committees. And so I guess would love to hear a little bit more on reflection on what folks are looking for, because to me it would make the most sense to have this interact with the CDNR committee. Particularly, I'm always happy to, you know, volunteer the mayor for some kind of direct communication, since I will never be in that position. But yeah, I guess, so wondering, other than maybe having a kind of direct line of communication and updates and support of CDNR, if there was something else that you all were looking for with that slide, or that bullet point, maybe not whole slide.
Yeah, Cameron, do you want to respond? It looked like you were ready to, and then Sarah, I'll come back to you.
Well, I will, and Kelly unmuted, so, but I can definitely add to it for
Yeah.
sure.
Okay, I didn't see you. Yeah.
That's okay.
Go right ahead.
Sure. I you know, having some experience of serving on a couple of different committees with the city, I think it's really important that there's an opportunity for us setting some benchmarks, right? And having some direct line of communication with the CDNR committee, and then also with the full city council and the mayor. And I see this more as perhaps quarterly or twice a year, where we're able to sort of really check in and look at where we're going with recommendations. And to Molly's point that she brought up about the importance of this committee being really engaging with older adults in the city, one, I think it sends a really important message to the broader community that older adults are important and they matter, but also an opportunity to really look at where are some of the gaps and needs. We have all the data, right? But also hearing and giving people the opportunity to have their voice be heard is really important in this process. So I see that slide being really focused on a way that we can have a clear line of communication with decision makers.
Yeah, and I'll add to that, Zoraida. So like the Transportation and Energy and Utilities Committee, like there's obviously pieces that impact that, and the Public Works Committee commission. I don't know which it is. And then, the Board of Health. So I don't have an answer, and I don't know if anybody on the call does exactly like what that would look like, but it's just if that committee is making some decision or working or responding to some issue, that this council have a voice in that as well. And instead of staffing every single committee with somebody from the council, yeah, I'm not sure how that would work, but it really is. It's like there are already committees that are theoretically tackling some of this stuff. So that was the purpose of it. And I want to just say, on a momentum comment, COVID has shined a light on this population. It's shown how challenged by the isolation and by the working from home, and obviously the pandemic is, in terms of the virus, has been so scary for this population. And I think we have an opportunity, and I would hate to let it slip, to just pivot the momentum that we have on the city level to this, because focus hasn't really been on older adults really at all for a continued amount of time. And if we let a year go, I at least personally worry that it'd be hard to sort of revive that momentum in a non-pandemic year.
Is there anything else, Soraya, that you wanted to share or ask there? I want to just add that the times I've mentioned this at council, sometimes I'll give updates for the committee as the chair. I get councilor comments back to me that are very supportive, but I also get citizens who were listening and said, boy, I'm really glad you're doing this. Boy, do we need this. This is something we should have been doing for a while and we just haven't. So there is real pent up support and demand for this, I think, is to bring a real focus and a real emphasis, and it's just really exciting. So.
Brian, if I can, I meant to say it also. So we can absolutely get a request for the CEDO participation. I guess the question would be timeline on that, like how, next week, by the end of the month, do you have some gauge on, because we can absolutely do that. It's just a matter of how soon we need to get it.
Well, the administration is probably going to start focusing in earnest on the budget. I think they've been doing it all along, but now that we know the federal assistance is pretty substantial. Federal assistance is coming this way. There's some discretion with some portion of that. We're getting about 19 million plus or minus, and about 7 million of that is essentially not sort of predetermined exactly how it will be spent. So there are new resources, and councilors may have their own priorities and preferences for how that money is allocated. But I would say it's probably important to get to it sooner rather than later. CEDO is largely not dependent on general fund dollars. CEDO is funded heavily by federal grants primarily. So that would be sort of a new ask or a new item within that budget.
And I think with the county funds that were cleared after the Board of Finance presentation, I think it's actually more than 9 million, almost closer to 20. In terms
we'll
of
take it. We can take that.
Got it. We got to.
I wanted 10. We wanted 10. We talked about like 9.
But you'd settle for 9. Okay.
Yeah, we're very flexible people.
20 million divided by each committee member.
Yes.
Yeah.
Perfect.
Yes. Councilor Carpenter, your hand's up, so I'm going to get you.
Just a couple different things. I think I think the most important is to get a structure with authority and a modest amount of staff, because you just plain need the staff support. So I think, all the federal money is going to have 10,000 strings, but I think it's a perfect example of that's why we need to get this starting to have the input, because those dollars are going to be programmatic and we need the structure and the authority. What I was going to say before, actually, and Cameron really covered it, Soraya asked about engagement, and I see, again, creating a council with, I'm just going to call it authority, like, and transportation is an obvious example where, and I'm not trying to diminish anything, but we spend a lot of time on bike lanes. And, what's the committee's strategy on accessibility and transportation for older adults? So I think it's trying to make those points. clear. We have a Board of Health, and I have to be honest, I'm not sure I understand or know all their strategic goals. Where do they sit, in this conversation? So I think it's just trying to, for us as a council as a whole, to say to each of our committees, you really need to take this seriously. And some are committees that honestly don't have tons of specific interaction, but it's sort of got to be in their mindset. But there's others that I think we need to say to them, pay attention when you're setting your committee goals. It ought to include us. I mean, our own committee, which covers things like housing and community development, is an obvious committee because we have a big overlap. But I think there's 3 or 4 other committees that really need to be pushed a little bit, and some of it's just like this cross things, like this whole conversation around where do you put public restrooms, that affects older adults. It certainly affects me. So I mean, just sort of really pushing some of those ideas, and with over 5,000 older adults in the city, we just need to keep making that point.
Well, I
If
think
I
the
can
next
just-
step for, go ahead, Cameron.
Well, I just want to say, to your point and to Zaraya's question, that's really the principle behind in the motivation for the Burlington Plan on Aging, that it would lay out in this area, and then from that point the city could direct committees for their strategic planning. So it really is sort of the motivation is to coordinate those strategy development that I don't think is there right now. So that was sort of the discussion around the Plan on Aging pieces to that point.
So I think for us, we like to look at next steps so we can actually implement and act. In the end, we'd like to move toward action. So we are, this council is sort of reorganizing on, we begin to
Monday.
next week on Monday, and committees will be formed within a couple weeks or a week or 2. But I'll assume, I mean, this is my priority, is to stay on this committee, and I assume my fellow committee members want to continue. So you're hopefully looking at the same 3 counselors to keep the continuity. We won't know, of course, until we get there. But what I would like to do is start working toward a resolution to bring to the council at our first business meeting, which I think is the 12th. Zaraya, okay, Sarah, is that right? The 12th?
I think so.
Yeah. So I know that's sort of soon, but you've got the
Do we have one on the
framework.
22nd too?
Yeah, we do the 26th.
Can't remember.
26th is a Monday. Yeah. So I will ask let's see. I'm gonna take your presentation and send it to Laura Hale, since she works. We have some hours left of her time. She's a staff person for some counselors, and give her the task of creating a council resolution to get this to the next step, which is to formalize it and move towards some level of progress and action.
Okay.
Did you see the note asking if you could share this presentation? You've already done that? Okay.
No, I'll do it right after this, and
Okay.
I'll send along Dale's letter of support, and then we'll also, while that's happening, put an official request in for the CEDO staffing. We can do that while that's
Great.
happening.
Okay.
And I can
Marcella, I see.
Yeah, and I can follow up on that with the acting director of CEDO as well. But it would be great to have the official recommendation and funding for the council as well as for staffing. But if there are stipends needed or something like that.
I think I'll probably ask you, Marcella, to talk to Katie about developing essentially a staffing plan or budget based on what we think it will require. So there's going to be some assumptions that have to be made, and it's you got to start somewhere, but I think we can make some assumptions about how much level of effort is required by staff.
Yeah.
Okay. What is there anything else? Yeah, to come.
Well, just to reiterate what I think was throughout the presentation, but I absolutely think this really should be at CEDO, and I'm aware, and actually in wearing other hats over the years, this sort of issue has popped in and out of Parks and Rec. And because, you know, the activities and the senior centers are a critical part of it, that's a clear priority. But I really do think we're saying it's policy and community engagement. And so I just want to sort of make sure we make that clear to the council and clear in our resolution. And I think obviously this council will interact a lot with PAC, which is the Parks, Arts and Culture Committee, because certainly parks, recreation, arts and culture are important things. But I just want to make sure we're clear to the council that it's broader than just to senior centers.
That's a really good point, Sarah, to make, because I think we did start this conversation a few meetings ago saying, you know, Parks provides all these direct services. What's the right place? And I think it's just good to kind of recap it with that. That's helpful.
Yeah.
Anyone else? We're all wondering when we're going to eat dinner, probably. So,
Brian, I think, I mean, it sounds like we're moving, and we'll draft a resolution that we'll share among ourselves, and hopefully Cameron can share it through the rest of this committee. And then we should move and regroup, and I think have this be our next agenda item as well, next meeting agenda item as well.
yeah, that's a good point. We probably will need to convene before that. I mean, we need to convene to talk about the resolution. As we have been reminded, we can't be drafting resolutions and doing that through email. So once we get through the reorganization where committees get assigned, we will take it from there and schedule a meeting to actually discuss kind of a resolution that lays out a lot of the operational aspects of what the Burlington Aging Council will look like.
I don't know if this is too quickly, but if we look at presenting this at the meeting on the 26th, we could meet maybe the week
Before that, or no,
the
that's
19th or something.
Yeah.
I mean, that would give you 10 days to pull something together. And I think maybe if one of us bounces it back and forth between Cameron, we can each, and then get feedback. And does that make sense?
possibly we have that tightness of schedule where you have to have an item in for the deadline on the Tuesday, the 20th, in order to be taken up by the council on the 26th, right? So if we're looking for, we'd actually need to have the meeting on the 19th, I think, to do that, Sarah.
Yeah, or even we could have it maybe the 14th or 15th if we think we can get a draft resolution done, and that gives us, well, that gives us
2
10
weeks.
days.
Yeah. And Christine had her hand up because I think she was going to caution us on something. I have a feeling.
I just wanted to speak to the counselors before you adjourn. So I just don't want just a couple minutes of your time. I didn't want you to jump off quickly.
Sure. We won't shut it down. Definitely.
Okay.
All right. Yeah. Okay. So I think we're
So
consensus.
if we met on the 14th or 15th, I don't know if how that works for Zariah. I haven't looked at my own calendar, but
I'm available. I want to make sure we're still the committee, right? I think there's that question about when committee assignments are official.
well, that's a good point. We'll make the new committee do it.
What was the date?
The 14th or 15th of April.
I can do both of those. You caught me.
Whoa, that's rare.
Yeah.
I think it's because we haven't scheduled any committee assignments past the 12th.
That's right. That's exactly what it is. Yep. Yep. Okay. All right. We won't set the time yet. I'll make sure with Council President Tracy, just whether we can safely assume that we are operating as a 3-person committee still.
Well, we can do a tentative thing and then.
Yeah, we can. Exactly. Yep. All right. Well, thank you everybody for your time, your support, your commitment to this. it's having you all as folks in this field and sort of working in the trenches available to us. We're pretty lucky. And I just want to point out that nobody seems to be getting turfy about any of this. So that's just a great quality we have to remind ourselves and celebrate, that we are less like that than some places. So appreciate that.
You can make the $10 million out to me and I will promise to
She'll take care of it.
Oh, speaking of turf, yeah.
Yeah, Karen's jockeying for the money already. Okay. All right.
Thanks, everybody.
Yeah, that's it. Everyone's welcome to stay, but you're also, we're now just going to move to committee logistics. So go ahead, Christine.
Thank you. Yeah, much less exciting request from my end, from CEDO. It has to do with scheduling. You guys were just talking about the next meeting. And Brian, I sent you an email. CEDO is currently drafting our annual action plan. And Brian, I think you're pretty familiar with the process. It is a lengthy one. It has to go through a lot of steps. There are a lot of hurdles, if you will, of like a public comment period and certain approval stages. Historically, we have presented to CDNR committee the draft action plan before we present to BOF and City Council. And we have asked just for your public comments back, your feedback, and then also your sponsorship, though, if you agree to or would like to, after reviewing the draft. So with our timeline this year, we were actually looking at, it was pretty close to the dates you guys were just discussing. We were hoping like for the week of April 19th to the 23rd to present to CDNR, but I think you guys were just discussing the 15th potentially. So if that's something, I obviously know you guys aren't going to have anything solidified tonight, but anything I can take back to my director to kind of discuss with her what you guys are thinking will really help us as far as like our drafting timelines. Like I said, there's so many steps and hurdles that we have to get through to get this officially submitted to HUD on May 15th. So it is a long process and we're hoping you guys will be a part of that process. So just wondering what your thoughts are on scheduling a short presentation from us for that.
I think we should plan to do it that week. That the 15th is, or 14th or 15th. Is that if you have something ready by then? It sounds like you could.
Yes, I mean, I think we were thinking a week out from that, but I think if that's what you guys, if that's when you're meeting, I will, we'll make it work. We try to allow a little flexibility with this scheduling. So the 15th, I'm just checking my calendar so I can take dates back to my director tomorrow and just let her know that I did discuss it with you. Okay, so the 15th, that'd be like a Thursday in April. You're thinking?
Yeah.
Okay.
I assume you'd like it done by the end of April, and that's why we were shooting for that. Is that right?
Yeah, so the biggest part with the draft is creating the first draft is kind of the most difficult part and is the longest part because we have to get it all submitted into this online HUD program, which is just an absolute bear and terror to work with. It's called IDIS. I don't know if any of you are familiar.
I'm very familiar with it.
It's
too much.
It's awful. So sometimes that takes longer for the numbers to balance in IDIS than it takes longer than we would like sometimes. So giving ourselves that little extra window to get that draft as nearly perfect as we'd like is always better. But we can certainly work with April 15th. I'll let her know, and yeah, that will be.
It's easy to remember too, tax day. So it used to
yeah, there we go.
It's not this year, but it used to be. Yeah. During COVID, they've extended that. Go ahead, Sarah.
Well, and another, I guess, I hate to throw, but I think there's sort of two pieces of it. There'll be the concepts and, what are you changing? What are you not changing? I mean, if need be, we could throw in another shorter meeting, 2 or 3 weeks after that to kind of review your final. So if you back up, when are you bringing it to the Board of Finance? Maybe we could slot in a review of the final
Yeah.
piece, but if maybe on the 15th you can review,
Yeah.
you know, what are you changing or not changing? You know, give us the highlight, because if there's things you're changing, I think we're going to be more interested in that than,
Mhm.
you know, or that's where you're going to want our opinion, I guess.
And is this the action plan that deals with the new money too, right?
Yeah, so I mean, I'm thinking there's going to be a lot more COVID narrative in this one, so it is going to look a little bit different than previous action plans. So, and that's a really good point, Councilor Carpenter, about that, because we were looking right now, again, this is our rough timeline, was May 10th for the BOF City Council approval. So that gives us quite a bit of room to work with if we wanted to come back and present something to you before then, even as it's more finalized. So that's a good idea. I will.
Yeah, maybe you can doodle us, and if maybe on the 15th you tell us your concepts and proposals, we don't have to worry too much about the format for IDIS.
Yeah.
You figure that one out. And then maybe that week of May 3rd or something, if you want to kind of flush it by again and give us the full document.
Yeah, that's a great idea. I will make note of that and see what my director thinks, and we'll go from there. But yeah, we certainly appreciate it, and we, like I said, we really historically have liked having CDNR part of the process for our action plans and our caper for what we do with our annual HUD funding. So it's an important step. We always try to make work if we can, even though we are on a tight schedule. So we appreciate it.
Will you know enough from the new money? I mean, because I'm just hearing this more on the state level, that we don't know all the rules yet.
What we will know is that CDBG and home, the rules don't change that much, I think.
Right. Those, you're right.
Those two, but the rest of the money, that's a different story.
Yeah. So this report is going to be focusing on the CDBG and home funds, like our annual allocations. But again, there is going to be a little bit of shifting and addition of narrative, because programs that have been affected by COVID and are going to be moving forward too, because we're not out of the woods yet with it. So there might be some changes you might recognize that are different than previous action plans. So.
Okay.
All right, great. Well, thank you for your time on that, and I will take that back to her and we'll make it work.
Okay. Great. I think we're all set. Is there a motion to adjourn, or is there anything else to come before our committee?
I'd move to adjourn.
Councilor Hightower seconded. All in favor? Ayes. Ayes have it. Christine, we're done. Thank you.
Great.
Thank you.
Everyone.
Bye-bye. Have a good night.